It is disheartening to note that children and adults alike continue to fall victim to this entirely preventable disease. Even more distressing is the over 600 people, mostly kids, who have died. Each new case is not just a statistic. It represents a family in distress, a community in mourning, and a nation grappling with avoidable suffering. This should serve as a wake-up call, reminding us that this disease, if left unchecked, can have catastrophic consequences. It does not have to be this way, because we have a vaccine that is safe, effective, and able to prevent this illness and deaths. In the past week, on behalf of the tax team, we have been able to lead an emergency cohort to an extensive tour of 5 states in Nigeria that are currently grappling with the diphtheria outbreak, and these states account for more than 90% of the suspected cases. These are Borno, Yobe, Jigawa, Kano, and Kaduna. The phase 2, round 1 of our outbreak response using diphtheria vaccine commenced on the 23rd of September 2023 and has unfolded in 7 states, encompassing 56 local government areas that are profoundly impacted by the ongoing diphtheria outbreak. The reach and impact of these concerted efforts have been nothing short of remarkable. Today, this ongoing vaccination phase has made a tangible difference in protecting the lives of 4,859,181 children across these affected states. A total of 1,692,762 children ranging from 6 months to 4 years of age have been diligently administered the pentavalent vaccine, a vital safeguard against this disease in this age group. In addition, an impressive 3,166,419 children aged from 4 years to 14 years have received the TB vaccine, further strengthening our safeguards from the disease among our children and teenagers. That vaccination alone is not enough. We must also raise awareness about the importance of immunization and the grave consequences of neglecting it. Our healthcare professionals, policymakers, parents, you, the media, traditional and religious leaders must work in tandem to ensure that every eligible individual receives the vaccine. Non-pharmaceutical measures are equally vital in our fight against this disease. Simple yet effective actions such as regular hand washing, using sanitizers, using face masks, and maintaining good respiratory hygiene can significantly reduce the transmission of the bacteria. Early diagnosis and prompt treatment are also essential to curbing the severity of the disease. In conclusion, we must confront the severity of diphtheria in Nigeria with a sense of urgency and unwavering determination. The numbers speak for themselves, and the consequences of inaction are far too severe to be ignored.
As of today, we have had just a little over 15,000 suspected cases, out of which 9,478 are confirmed cases. And they have come from now a total of 137 local governments in 20 states, including the FCT. As we are aware, the outbreak started much earlier in Kano and continues, so Kano has most of the cases. There are now other states, Yobe, Bauchi, Katsina, Borno, Jigawa, Kaduna, that have now contributed cases, and together these 8 states are responsible for over 95% of all cases reported so far. Of the 9,478 cases, 71 or about approximately 72% are aged 1 to 14. Now, in terms of a breakdown for you to fully understand the most affected age group, the infants that have been affected in this outbreak constitute less than 1% of all cases. Those that are under 5, that is aged from 1 to 4, constitute 14% of all cases. Now, the age groups that are most affected are the 5 to 9 year age group, which make up 31% of cases, and then the 10 to 14 year olds that make up approximately 27% of all cases. Older adults are not spared. Those that are aged 20 years and above constitute 16% of cases. So the decline in case numbers and deaths reflects the progress that has been made by all actors, national, especially state, and all of those operating in the front line, and with the support of our development partners, especially since the inauguration of this high-level coordination mechanism, which is the Diptheria Emergency Task Team. There are challenges in that regard, challenges in terms of bed space, challenges in terms of ancillary investigations, challenges in terms of access to some higher level of care or critical care to support treatment of complications arising from diphtheria. But these are being addressed as we speak, and indeed in the states where there was a challenge with ancillary fees, those costs are now currently waived for all patients. And we continue to facilitate the collection and transportation of specimens for diagnosis through our third-party logistics firms for both movements across states and to the reference labs as well. Diphtheria is a preventable illness. There is none of us who, knowing that we can prevent something or take action to prevent an accident or to prevent something bad from happening, that will not do so. The way to prevent diphtheria is to make sure that all of our infants are fully vaccinated according to the National Childhood Immunization Schedule as prescribed by NPHCDA. The second thing is to make sure that we make use of every opportunity that is provided to receive vaccines as infants or to benefit from the campaigns that are ongoing as part of the outbreak response. In addition, please take note of the common symptoms of diphtheria, such as fever, runny nose, a sore throat, cough, and red eyes. There can also be a patch or membrane at the back of the throat that may contribute to symptoms of difficulty in swallowing and breathing, as well as neck gland enlargement that can suddenly make you look like enticing or booming. With any of these symptoms, please present promptly to a healthcare facility, notify local public health officials so that appropriate diagnosis can be made and early treatment can be instituted.